Is your vaccine authority, and we have been getting so many questions about the vaccine, and each day we're helping to get you some answers. Joining us this afternoon is Dr. David Banach. He's an associate professor of medicine with UConn Health. Dr. Banach, thank you so much for being with us.
Thanks for having me on.
So first question, let's get right to it. This is Patrick from Newington. He says, I have a peanut allergy. Does this affect me getting the vaccine?
So when it comes to allergies, there's very few contraindications to getting the vaccine. So the vaccine can be given to people who have food allergies, insect allergies, environmental allergies, and allergies to medications. The one group that we worry about in terms of extra precautions are those individuals who have had a severe allergic reaction to a prior vaccine, and folks who have had severe reactions to other injectable medications. And then lastly, anyone who has an allergy to an ingredient in one of the COVID vaccines. So those are the real main things we worry about. But peanut allergies, other food allergies shouldn't be an issue. And even if you do have one of those other conditions I mentioned, it's really in many cases just an extra prolonged observation period after the vaccine. So not even a contraindication to actually getting the vaccine.
Yes, that's that extra 15 minutes after the vaccine to make sure everyone's safe. Also, Lee from Meriden is writing, I had my first Moderna vaccination. 2 weeks later, I came down with the coronavirus. My doctor told me I do not have to get the second shot because coming down with the virus was my booster. Is this true?
So interesting question. We're learning a lot more about these vaccines and how they affect people who have had coronavirus. So first, I'm sorry to hear that you did have coronavirus infection. I hope you're recovering. But at this point, the CDC and FDA recommendations still stand that even if you do develop a COVID infection after the first dose, you still go ahead and get that second dose in order to ensure that you have adequate antibodies and protection in the future. There's a possibility this, as we learn more, that might change. But at the moment, the recommendation is still to get the 2 doses. And importantly, to ensure that you don't get that second dose until after you're out of that contagious period, after you do get the actual coronavirus infection.
Okay, makes sense. Last question. This is from Sandy in Torrington. She wants to know, if I am healthy and have a good immune system, why should I get the vaccine?
So a really key question. I think what we know about the vaccine is it's very effective in preventing people from becoming sick. Typically we do think about people who have those risk factors, older individuals, people with other medical conditions as more likely to become sick. But we see COVID-19 infections that can be really severe even in young and healthy people. So it does provide protection on an individual basis. But I think just as importantly, we're learning that these vaccines really reduce the ability to spread the virus to other people. So, even if you do develop very mild symptoms, don't necessarily become really sick or get hospitalized, having a vaccine prevents you from even spreading the virus to other people if you do develop a very mild illness, or even if you develop infection and don't have symptoms. So, really the vaccine protects you as an individual, but also protects all those around you, your friends, your family, and others in the community who you're in contact with. So, all the more reason to get vaccinated.
Well, you are a wealth of knowledge, and we always appreciate you coming on to sort all of this out for us. Dr. David Banach, thank you so much.